2022. Thank you so much for joining us. IMS's mission is to bring together an international community of healthcare providers, researchers, educators, and others to improve care and transform delivery of treatment to those suffering from soft tissue pain through the promotion and exchange of globally recognized research, education, and innovation in patient care. My name is Dana Taylor, and I'm honored to serve as the Executive Director of IMS. After the webinar today, please go online on our website at myopain.org and become a member. We're in a critical rebuilding state, and we really need your support. There are wonderful benefits for IMS members. Now, let me just take a quick minute to introduce you to our webinar presenter today. IMS board member and secretary of the board, Mary Biancalana. She is the president of National Association of Myofascial Trigger Point Therapists, clinic director of Chicago Center for Myofascial Pain Relief, and owner of Advanced Trigger Point Seminars. And she will provide us video examples of live in-clinic treatments that have been very successful in eliminating shoulder problems. This webinar will take an interesting look at hands-on treatments to eliminate shoulder pain. Thanks so much, Mary, for doing this today. We're excited to learn from you.
Thanks so much, Dana. So happy to be here.
Oops. Hi, I'm sorry. I'm making difficulties here. Let's see.
Okay, we're going to get it. How about that? You turned me off, Dana, instead of yourself. All good. Thank you.
Sorry.
All great. Thank you. So nice to be here and welcome to everyone. Looks like we've got a nice big group here from all over the world. Welcome to our physiotherapists. Welcome to our nationally board certified myofascial trigger point therapists. I see a lot of you on the call. We've got IMS members and supporters. Peter Strini, Dr. Mike Sorrell, great to see you. Rosemary, Carrie, wow. Welcome to all of you. Lois, part of the NAMTPT board. So welcome to all of you. I may be calling on you during any time during this webinar. And so pay attention because I've embedded a few mistakes. And so you guys are going to be able to use the chat feature to see if you can find some of the mistakes that I've embedded for you today. So yes, I am a licensed massage therapist, board certified trigger point therapist. I am honored to be participating in the NAMTPT organization, as well as the International Myopain Society. I have no pharmaceutical or other conflicts to disclose. I simply am disclosing that I am a currently practicing trigger point therapist and an education provider. If in the future you need any more information from me, I'll be giving you my contact information as we go forward. So what is the purpose of this lecture? We're going to be together for 45 or 48 minutes today, and I'll also be showing some video examples of some of the treatment techniques. But the purpose of this lecture today is to showcase the value of hands-on manual therapy, whether you utilize it as myofascial trigger point therapy or other applied manual therapies. We know that this manual therapy is a support to any medical practice wanting to aid in pain elimination. That is a medical practice, a clinical practice, massage practice, physio practice that is focusing on utilizing pain relief techniques without the need for pharmaceutical intervention. We also want to highlight the unique treatment options for some of these overlooked muscles in the torso and shoulder. We all know the big players, right? We know where the rhomboids are. We know where the deltoids are. We know what the serratus, we know where the supraspinatus is, the infraspinatus, subscapularis as a strong internal rotator of the shoulder. Well, I'm going to be highlighting two key players in this presentation Here's my first mistake. So I've highlighted serratus posterior inferior when in actuality, we're going to be highlighting serratus posterior superior. Serratus posterior superior, and I'm interested in the referred phenomenon and the referral pattern of the pectoralis major as a cause for front of shoulder pain, and I'll be highlighting serratus posterior superior as a cause for posterior shoulder pain. So for those of you that might have your Travell & Simons books ready and available, go right ahead and let's have somebody type in the chat. Well, I'm holding volume 2, and the only reason I'm holding this volume 2 is this is my lucky charm. This is my volume 2 that was signed and autographed to me by Dr. Simons. So this is my lucky charm. But those of you know, can you give me this volume 1 here? I want you to have your volume 1 available to you. So if somebody can find the pectoralis major chapter, you're welcome to type the page numbers of the chapter in the book for pec major. Then I'd also like someone else to type in the chat the pages for the serratus posterior superior chapter. And those of you that are at home that might have your own anatomy books, go ahead and put a flag or a pin in your anatomy books, because we're going to be talking about these two really important muscles today, pec major and serratus posterior superior. This program is also going to be helping you guys, the practitioners, whether you're an MD, a doctor of osteopathy, a physiotherapist, physical therapist, massage therapist, trigger point therapist. I want those of you at home to be able to be more focused on assessing for and treating myofascial trigger points, MTRPs. So let's look at that abbreviation that's there, guys. MTRP. That is going to be the abbreviation for the myofascial trigger points. Another purpose of this lecture is going to be to show advanced manual therapy techniques that are possible so that you can have the best patient or clinical outcomes. Very good. Thank you so much, Lois. We've got serratus posterior superior found on page 901. Joanne Lindstrom. Thanks so much, Joanne. Awesome. And then when we get our pec major pages right out of the Travell books, somebody can type that in there. And then lastly, I'll be planning to demonstrate self-care resources that are available to you in your practice, as well as to your patients or clients, so they have the power to eliminate their own pain. So thanks also to Bonnie Pruden. So not only did Doctors Janet Travell and David Simons, we have to thank Bonnie Pruden, Tasso Spanos, Richard Finn, and all of our wonderful educators that are out there and teaching the trigger point therapy model. And many of you were educated by the Bonnie Pruden School for myotherapy. So there's lots and lots of excellent education options that we are grateful for those that have come before us. I've had the great opportunity to travel the country and study from so many practitioners and providers. I'm very grateful to all of them. And certainly to Dr. Renee Hartz and to Dr. Michael McNett and to Dr. Angelique Mazira for providing me some of my excellent trigger point therapy education through the years. So we're also going to be answering these key questions today, guys. Can trigger points create shoulder pain? Raise your hand if you know already the answer is yes. Can we use trigger point therapy techniques to eliminate those trigger points in the muscles? Raise your hand if you know the answer is yes. Can knowing the presence of trigger points in certain muscles actually predict? Can we predict the potential for future injury? You know the answer is yes. And can the patient or client education improve our clinical outcomes? The answer is yes. So we're not just here to provide the clinical intervention, We need to give the patient or client homework to do at home. And I've got hundreds of free resources, free and available to all of you to take right off the YouTube channel and provide these resources to your own clients. And those, of course, will be those self-care education resources. So myofascial trigger point therapy, what the heck is it? Anybody also want to use, oh, sometimes if I raise my hand, it hurts. Did we ever, whoops, sorry. So anybody want to take a stab at giving us the name of the muscle that's here in this illustration? Anybody want to take a chance? So I'm going to keep you guys involved. I want to see everybody typing in the name of this muscle that I've got here as I give you the 7-step complete and comprehensive system. Oh, we already got some winners. Keep going if you haven't typed it in yet. So we know that myofascial trigger point therapy is a complete and comprehensive 7-step system of myofascial evaluation, manually applied treatment, and movement retraining. Guys, our job is to normalize contracted sarcomeres that are stuck in the sarcoplasmic reticulum. We can thank Jay Shah. We can thank David Simons. We can thank Dr. Bob Gerwin. We can thank Dr. Siegfried Mensa. We can thank all of our previous researchers that have done awesome research papers on the biochemical milieu. I'm not here to discuss the biochemistry, but we know that we get soft tissue pain in the muscles, tendons, and fascia by these contractile problems and biochemical inadequacies. Our job as the manual therapist is to restore normal resting length in the muscles and to return the person, the client, to full mobility and function. Everybody bring your arms straight up over your head. Let's go straight to try for 180 degrees of, I've got my right arm up, of abduction. Even those of you that are my clients and patients, welcome to Anne, welcome to Augustine, welcome to Cameron. Those of you at home may not be able to actually raise your arm all the way up to the ceiling. There may be orthopedic reasons, or there may be myofascial reasons, and that's what we're going to try to figure out today. So because I've already said that there is a 7-step protocol, this lecture is skipping the other 6 components, which include taking a detailed history, assessing for perpetuating factors, measuring objective data that gives us the starting point of the client, range of motion and restriction. We also take subjective data, including a analog pain scale, a diagram of the person's pain. We use the Travell and Simons individual chapter headings to determine what muscles might be causing a particular person's pain. We treat the pain. We assess if they're better when we're finished, and then we give them self-care activities to be at home. But if you'd like to know what the full 7-step components are, there's a very easy, layperson's easy to understand article that's available to you to load as a PDF. I will also work with Dana and Dr. Antonio Stecco to get some of these articles available to you at the IMS website, myopain.org. And we're going to be having many other perks that will be available to you, our IMS members, including recordings of these webinars and free perks for other pre-recorded webinars, including an awesome program that's been done by Dr. Bob Gerwin, Professor Emeritus at Johns Hopkins University in the Department of Neurology. He does an awesome program on pseudothoracic outlet syndrome, and we've already got that pre-recorded. It would normally be costing money to register for that, but we're going to give those of you that become a member of the IMS a link to that webinar for free, and you will not have to pay for that once you become a member of the IMS. But you're welcome to go to marybiancalana.com, articles to read, and the 7-step program is there. So for today, we want to remember, it's not just about the trigger points. We want to assess the whole person. What is the kinesiology of the motion that bothers them? In the shoulder, is it flexion? Is it extension? Is it circumduction? Is it external rotation, internal rotation? We want to take those things into account. We want to know, what are the perpetuating factors in this person's problem? Look at me on my little screen. Do they sleep with their arm near their face? Do they sleep with their arm tucked under their head? Well, I hate to break the news to you guys, but you could be the most brilliant physiotherapist. Peter, I know you're here. And I know that Rosemary and Carrie and Joanne and Ann and Cameron, you are all excellent care providers. Some of you are patients. David, Philippe. I know that some of you, Jim, Catherine, Kim, Kristen, you may be the most brilliant care provider, but if you don't ask your clients what they do when they go home to perpetuate their myofascial, myo being muscle, fascia being their fascial problems. I know we have a lot of our stecco fascia manipulation practitioners with us, and thank you, welcome. We are brothers and sisters and people together in the same family, helping people get rid of their pain and problems. But we all need to ask these questions about what are the factors that create these problems. We need to integrate all muscle areas. I'm in my second bullet point here. All muscle areas that could be not only a primary, but also a secondary cause of the pain, problem, and dysfunction. Got it? And then the third little green box here says, we all have excellent abilities in our tool belt. You might have wonderful techniques: fascia manipulation, fascia release, trigger point release. You might use a cold laser. You might use a percussor. You might use frequency specific microcurrent. You might use PNF, proprioceptive neuromuscular facilitation, or RI, reciprocal inhibition. We have some osteopathic providers on the call today, and welcome. You have osteopathic manual manipulation techniques. All of those come into play. So what are some of the muscles in the shoulder and how can they cause trouble? One, we're going to learn about a man called Edward. He has back of shoulder pain every day when he wakes up from sleeping. He has a healthy lifestyle, eats well, drinks lots of water. Sounds pretty good, right? But type into the chat box what tiny little clue is hidden in those few sentences I told you about Edward. And what did Dr. Travell tell us? The mystery is in the history. What tiny little clue do I have embedded here that we might be missing about Edward? Read it again. He is back of the shoulder every day. But when does he have back of the shoulder pain, guys? There's a little hidden thing in there. Very good, Carrie. You got it. Joanne, Sean, very good. There were clues in there. His sleep posture. Woo! Next case example number 2, Joanne. She gets a strong sensation in the front of her shoulder every day. She uses a laptop computer. She types data entry all day. She's a smoker. She hates to drink water. She uses fast food. I won't give any. And 4 times a week, she drinks lots of soda. So in there, we have some hidden clues, but nutritional could be a perpetuating factor. Smoking is certainly a perpetuating factor. But what is the clue about the front of her chest? What type of computer does she work with every day? What type of computer? What style of computer? I hid it in there. What style of computer does she work with every day? A full-size desktop computer? Aha, very good. Chrissy, you got it. This person uses a laptop computer. Keep that thought, everybody, and let's move on. Keep that thought and let's move on. Case 1, Edward. The back of his shoulder pain every day when he wakes up from sleep. What muscles do we know can cause shoulder pain? And guys, what can we use? What resources can you use to determine the list of muscles that cause shoulder pain? Of course, in my training program, I have them all listed for you, but I definitely don't have the time in this 45 minutes. So we're going to go to the Travell and Simons books. And in the books, Doctors Travell and Simons and Lois Simons and all of our other contributing authors have excellent resources here. So we know that the list of muscles are all here, okay? And it is quite a bit. Infraspinatus, deltoids, scalenes, supra, pec major, pec minor, biceps, corgo, sternalis, subclavius, latissimus dorsi causes front of shoulder pain, but this guy has back of shoulder pain, which includes deltoids, levator, supra, teres minor, subscap, serratus posterior superior, and the list goes on and on. But what's causing him to have pain in the first place? You already said it, poor sleep posture. And what are the key perpetuating factors that can cause these problems? So let's take a look. We already know that many muscles can contribute to back of the shoulder pain, sensation, and dysfunction. So many thanks to Jan Damerholt, Las Peñas, and all the authors of our Delphi study. We therapists have already known that trigger points can cause many types of sensation. So the first image on the right-hand side, hey, Dana, I don't know how to get a pointer, and I don't want to mess up my screen. Let's see if I can get a pointer. Call to action.
The white arrow down here. This is right here and select pointer.
Oh, I see. So you know what? My screen and my laptop, it keeps minimizing. Thank you, Dr. Stecco. Thank you. Okay, here we go. Pointer. Thank you so much. Oh, I see you. Do you see me now?
Yes. Go ahead.
Thank you. So we see the trigger point found here in the serratus posterior superior. Then we've got our scalenes. Let's keep this image in our mind and we're going to move on, but talk about them later. And then you can yell it out from home. Anybody want to tell me what image is illustrated here? What muscle is illustrated by this double trigger point, wicked shoulder pain, and Dr. Travell calls this the stiff neck muscle. I know you're yelling it from home. It's levator scapulae. So we know that serratus, in my opinion, for this particular lecture, I wanted to focus on serratus posterior superior because I believe it is one of the most overlooked and difficult to treat to get really at that medial most trigger point, which can be hidden by the scapula. And in this image here where my cursor is moving, you see that we have to do a large amount of not shoulder retraction, but protraction. Everybody at home, join me together to squeeze your shoulder blades together, and that's called retraction. And now hunch your back, that is protraction. Squeeze back and retract in the vertical plane, and then protract and hunch. I'm going to show you what I think is going to be a fantastic resource for you to treat your clients that you might not ever have thought about. So I'm going to be showing you, it's just about a 2-minute and 20-second video. Dr. Stecco, thank you so much for helping. We're going to be playing a video which will be showing you the serratus posterior superior. So I don't think it's going to play from me, Dr. Stecco. Thank you. All right, so we're going to be going over treatment of the serratus posterior superior. It's often an overlooked muscle that creates shoulder pain, arm pain, and ooh, it can be a real stinker when it's harboring trigger points. So we're going to, we could start face down for a moment. Come on, face down, Mike. And you're going to put your chest there, forehead here. We would not normally do much treatment, but I want you to start to get some of your landmarks, or you could have your body support system here. So I want you to know where the spine of the scapula is, or you could have your body support system here. So I want you to know where the spine of the scapula is. I want you to be able to feel where the medial border of the scapula bone is. You can see that when we drop the shoulder down, even in this position, the scapula doesn't protract that much. It doesn't really expose the trigger point that could be under the scapula as part of the serratus posterior superior. So what we're going to do is we're going to go more advanced. I could treat there, but this is advanced. So you're going to thread the needle. You're going to bring your arm across in front of you. Keep yourself on your tummy. And then this pillow is going to be there. Are you able to breathe? Yes. Okay, good. So now we've really got a scapular border that's been pulled away. And I still want to get my landmarks. And my serratus posterior superior is going to be coming in this direction along with the rhomboid. So I'm going to feel for the medial spine, and I want to treat down and in. I'm going to stay upright, and I'm just leaning my force in this direction. My back leg is driving my pressure. Give me a number of discomfort. 3. Any referred sensation, traveling, or just local? I'm going to back off. Let's have a breath in and treat again. As usual, 3 strikes, you're out. We're going to be increasing ever so slightly. How's the number now? 4. Here we go, breathing in. I'm backing off, maintaining contact, treating again. How's it here now? 4. Any traveling or referral? A little bit into the shoulder. Okay, that's very good to know. So again, I'm going to find myself now coming in an upward direction, because again, I know that I've got fibers that are going like this coming up from the cervical vertebrae, but I still want to stay lateral along that scapular border. How about here? Versus here? 4. And then I can work my way down along the medial border, and I'll also be treating the rhomboids as we go. We also gave you some other ideas on treating. Come on up, that's long enough. So we don't want to aggravate the pecs on the short. So the other thing to remember is we have other muscles that can contribute to discomfort in the shoulder, and we also don't want to keep the pecs on the short for too long. So you might need to turn the client over, have them then go on their back. Go ahead, right on your back here. Good. And then, obviously, for the sake of the video, I was treating this side. Well, I can still go over here. So then what we might need to do after we've kept the arm across the chest is open up the pecs and then treat down and in into the pecs to make sure that we don't have a shortening activation of the arm being held across the chest. So that was prone treatment of the serratus posterior superior, aka Okay, thank you so much for facilitating that for me, Dr. Stecco. So remember, as I said in one of the first slides, it's not just about the trigger points that we are trying to focus on. It is the whole person. So when one arm is extremely horizontally adducted, so that we can extremely protract the scapula, we have to worry about the other muscles that are going to be on the short. So that's one of the big components in my 23 years here in trigger point therapy. I have spent my career making sure that we focus on what is happening on the short or what things are contracting on the short. We don't have time to talk about that in this program, but that's information to consider. So it's not just what you're treating, but it's all the other muscles around the entire okay, so sorry, Lois, you couldn't see the video, but we were able to see it. So the videos will be available for you. We will make sure that the IMS is able to embed these videos. They will be available for you. to watch. Someone else is typing, so hopefully you were able to see the video play. Okay, so case example number 2, someone named Joanne. Do you remember what was the clue? What was the clue about this person besides crappy diet and doesn't drink enough water? The clue was that this person works on a laptop computer all day. We all know that many of our own clients have to spend time focusing on their computers for work, and we'd love them to stand a little while, sit a little while. I'm also recommending that all of my people get a full-size keyboard, full-size keyboard, absolutely full-size keyboard, okay? So we can take here that we know there are other muscles that can cause front of the shoulder pain. Anybody want to type in the chat box? I know you can yell it out from home. We won't hear you, but yell it anyway. What muscles, trigger points are we illustrating here, guys? I know many of you know it. Very good. Look at that. Augustine, Joseph, wonderful. Peter, you got it, buddy. Good job, everybody. And I know I could hear you at home. So it's really fascinating that we never want to forget that trigger points in a far distant location can contribute to sensation. But for the sake of this class, I wanted to show you, yes, I'm sure we all treat the pec major. We all want to remember, can you see my cursor, everyone? Thank you. Yes. Thank you, Dana. So right here, we've got our clavicular division, the superior most division of the pecs. Then we've got our sternal division, and then we've got our costal division, that lower division. And by the way, here's a little tidbit for you guys. Did you know that Barbara Cummings always snuck her initials in every illustration that she drew for Travell and Simons? If you look down here, you see a little scribble. That's Barbara Cummings's initials. How wonderful is that? And it is Barbara D. Cummings. So you always see BDC snuck somewhere in her drawings. So we know that this sternal division, each one of the divisions of the pecs can create their own referral pattern. A real easy way to remember P pecs, pecs to the pinky. Pecs can go down the ulnar side of the arm. Certainly the pec minor creates that paresthesia style sensation. But we're going to be interested, for the sake of the class today, for these superior most clavicular division and the distal fibers in the pec, these two trigger points here. So thank you so much, Dr. Stecco. If you'd like to play the video. You might not have been thinking of treating the pectoralis on the side. Also, one more thing, there are a few interjections that come up that say supination and pronation. I've just realized my video guy put those in for no reason, but thank you, Dr. Stecco. All right, guys, we're going to be doing the pec major. And again, always as an option would be to have a folded barrier, because for some of these treatments, I do press my hip against the patient's back, or the client. I would have said, I'm going to put this barrier against my hip, Mike, because I need to lean my hip in. So for the pec major, what I want to do is I'm going to bring their elbow and their humerus into extension if I just want to treat the middle or transverse segments and or possibly the upper trap. I certainly could bring the elbow and open the arm. Could you tilt my camera down over there? Back. But I really don't want to do that because it's a long lever and this is a heavy arm and it's a lot of work for me to manage this arm. So I can take the elbow out of it and just bring the humerus back. So you can see I'm leaning back and I'm literally bearing the weight of his torso on my abdomen through that barrier. So then from here, I can rotate my shoulders, keep my humerus near my own chest. I'm up on my back toes, and then I'm leaning in and pressing. I'm going to open this arm, and I'm going to put his arm along his outside of the hip. So I'm just choosing to start here at this pec major, outside trigger points closer toward the deltoids. And I could say, give me a number of discomfort I'm causing you. And you can see I've raised myself up and leaned in so that all I have to do is lean my weight in this direction so that I'm not really engaging my own pecs. I'm simply pressing forward. So I'm leaning in, give it a number, 4. So again, I've got his arm into just standard extension. So I'm going to be treating the upper and mid portions of the pecs. If I want to treat the lower portion of the pec, so the lower portion, I could bring the arm all the way out into abduction. Again, I'm leaning in, and remember, we can treat the lower portion of the pecs here. So my goal is to keep my arm, some tingling into the hand. I'll give it a number. 5, it's already a 5. Any referral or shadowing or traveling? No. So we can have him push the arm forward while it's already abducting. So at 1% strength, bring your arm in that direction. Go ahead. Good, hold. So I can use active, contract, relax. So now since his arm is abducted, we have the lowermost portion on the stretch, but even all the mid portion of the pecs are helping to add to adduction, horizontal adduction. Big breath in, let it go loose. So I'm going to manage this arm, but honestly, it's heavy for me. So I'm going to manage this arm at the elbow. It's still extended, and I can treat from here. I could treat from here. And again, give me a number here, Mike.
1.
We could bring the arm straight down and get the more transverse fibers, or bring the elbow down and treat. Okay, wonderful. So you saw the specific 3 divisions of the pec in that particular video. So I just wanted to give you an example. And as I said in one of the earlier slides, it's not just about the trigger point pressure release. We want to always treat on the maximally allowable stretch that the client or patient is allowed to sustain. And so our goal here is what? We know from all the research papers that this whole program is not about citating all the research. I have it all in my training program, but we know that we've seen ultrasound studies. Dr. Siddhartha Sikdar did a beautiful, phenomenal 3D Doppler ultrasound program for the IMS maybe 4 or 5 months ago, in which we saw the data that his research group showed after static compression and release of the compression, and they're finding hyperperfusion, perfusion, increases in blood flow, increases in reduction in restriction and fascia components. So we know that this works, and we just know that we need to add the entire full and complete 7-step trigger point protocol, which always includes, and I know Dr. Gerwin and Dr. Simons had this in one of their later papers, probably even close to when Dr. Simons passed away, when they talk about try to bring the area into 3 full complete range of motion. After you apply the trigger point pressure release, I agree 100%, but this is a short workshop and we're just trying to sneak it all in. I wanted to remind you here that the scalenes can, of course, cause front of shoulder as well as back of shoulder pain or sensation. It's not just pain. So we wouldn't have normally jumped right into the 2 muscles that I'm highlighting here. I chose them because I thought the videos were interesting and out of the ordinary, but there's an entire clinical reasoning that brings us to the most probable muscles that should be treated. And honestly, I always tell my students, always start at least 1 joint above where the client or patient feels or has their problem, pain or dysfunction. We don't want to neglect the rhomboids here. We certainly don't want to neglect our little anterior or posterior deltoids. But honestly, in my clinical opinion, 22 years full-time, I would say the rhomboids are very rarely the problem. Medial scapular border pain can be caused by latissimus dorsi, serratus anterior, certainly from levator scapulae, and certainly from scalenes. So I don't spend much time treating the rhomboids, but I also want you to know that there are self-care protocols available. So when somebody does have restriction or problems in the deltoids. This last video is about 1 minute and 30 seconds long, and we'll see an example of self-care, which empowers the patient to do it themselves. Thank you, Dr. Stecco. When we feel pain in the front of the shoulder, it definitely could be referred pain from other muscles in the neck or even in the back of the shoulder. However, the deltoid muscles, which live right here at the topmost portion of the shoulder, can themselves harbor trigger points, which in the deltoids refer their pain just locally right to the segment of the shoulder where they live. To apply trigger point pressure release to the deltoids, we're going to take a lunge in a doorway or along a door frame. We're then going to apply the tiger ball as we lean forward to the front segment of the shoulder. We can put this segment of the shoulder on the stretch by bringing our arm behind our back or by externally rotating. Then we can place the ball on the forward segment of the deltoids. For the lateral or side section, we simply need to stand sideways, and for the posterior segment or the back segment, we need to bring the arm in front of our chest and stretch the arm outward. Apply trigger point pressure release, 15 to 20 seconds, and move to another location. To stretch the deltoids, bring the arm in front of your chest or even behind, reach up and back and down below, or reach forward and down. Forward and down, or internally and externally rotate the arm. That's self-care for the deltoid muscles causing shoulder pain, brought to you by the Chicago Center for Myofascial Pain Relief. Okay, thank you so much, Dr. Stecco, for helping. So, as we said, the 7-step protocol, we are changing and normalizing contracted fiber bundles, and everything that we do is a help. So we're normalizing the muscle, the fascia, all the layers and all the soft interconnected tissue structures that need to be allowed to move freely in the best pain-free option. So many thanks to Amber Davies, a dear colleague and NAMTPT member, and of course to Claire Davies, who is now deceased, for Claire's hard work in producing the Trigger Point Therapy Workbook. This burgundy one is a copy of my book, Trigger Point Therapy for Low Back Pain. It's not published, but you can get used copies. You can also find huge parts of it at Google Books. Google Books has hundreds of thousands of portions of books for free on the Google platform. And then this is another excellent example of a very easy and simple illustrated book for the layperson called Happy Muscles. And this was written by my friend and colleague and NAMTPT member and IMS board member, Spring Fawcett. So we're grateful for Spring. She has been a generous supporter of the International Myopain Society. She is a board member. Thank you, Spring. And Dr. Julie Zuliger, who is the past president of the NAMTPT Trigger Point Therapy Association. You can find this at tigertailusa.com. So we need all of you to join the IMS, International Myopain Society. We do a lot of teaching. We focus on teaching and research for myofascial pain and fibromyalgia. In June 2023, we're going to be having a World Congress. I'm going to be so excited to be there. I'm on the board. I'm a co-chairman of this wonderful event together with Dr. Stecco. And we thank all of you for learning with us. But the IMS is going to be making big strides moving forward. If you do become a member, you get a discount and exclusive access to videos and all kinds of coursework that we're going to be loading onto our brand new, beautiful website. Thank you to Dr. Stecco and the NAMTPT for helping facilitate a brand new website I was also part of that committee. You can find us at myopain.org. So you'll get professional resources. There'll be videos posted there for your future review. We'd love you to click and subscribe to our newsletters. I think you are subscribed. Our organization is an international resource to be a worldwide group focused on drug-free myofascial pain relief. We want you to be a part of this group, and we're focusing on that. Make sure that you like our pages. You can like my pages. I've got this free YouTube channel, which is under Chicago Center for Myofascial Pain Relief. I always tell my students, do not, look at my face, do not type in trigger point release on YouTube, or do not type in trigger point resources on Google. We don't know what kind of junk is out there. And so please stay within the programming. We also are myofascialtherapyorg is a sister and supporting organization to the IMS. That is the organization for the Trigger Point Therapy Association. And we'll be taking some questions. So if you want to start thinking about if you have any questions. Oh, sorry. I just wanted to go to that last slide, Dr. Stecco. I apologize. Oh no, was there one more behind there? I just wanted to show, whoops. I'll go all the way to the end. 23. So did we answer these questions and do we achieve our purpose? So I always like to show that, yes, I showed the value of myofascial trigger point therapy that can be a support to your practice. Next, I want you to highlight, I wanted you to see there's some unique treatment options for serratus posterior superior and the pec major. I want you, the practitioners, to be able to be more focused on assessing and treating trigger points. And I see that some of my own patients and clients are on this call. So the self-care video was there, of course, for you. And I wanted to show you advanced manual therapy techniques and then demonstrate their self-care resources. Okay, Dr. Stecco, thank you. I'm finished. So if we have any Q&A or any other input from you guys, I saw that maybe it would be interesting for you guys to learn about the pec major. If you've got any questions about the serratus posterior superior, that's a little tricky little muscle. Thank you, Anne-Marie, for your input. My daughter, Anne-Marie, is on the call. She has been part of my technical team. I have to thank Dan Curley Productions for all of my video work. Thank you, Joanne Lindstrom. Thank you to everyone who's been on this call. And you know, it is tricky, guys, that serratus posterior superior can be a very easy question to overlook. Have any of you found any luck treating the serratus posterior superior? Anybody have any other input about, like, how do you know, it's a tricky one. You have to be very careful. Here at our clinic, our doctors have utilized trigger point injections. And of course, the injection direction for I am not qualified to tell any of you how to do it, but I've observed tens of thousands of trigger point injections. And I've seen our physician providers utilize a super short, I mean, a quarter of an inch long, super short needle. And they always go obliquely when they do the trigger point injections. Let's take a look here. Oh, thank you, Marilyn Stocker. Yes. Oh, great. The group at the IMS does have my permission to keep this webinar as a recording, and we'll probably have it at the IMS website. We'd love to be able to drive more people to myopain.org. And so we would love to have all of you using the myopain.org feature for your resources. I also can tell you there are lots of resources, question and answers, frequently asked questions at the my website, triggerpointcenter.com. There's a Q&A feature. There are also frequently asked questions. By the way, for those of you that are practitioners, the Q&A, that the frequently asked questions that I have on the NAMTPT website, we can also provide them to the IMS. We are very grateful to Dr. Janet Travell's daughter, Janet Travell Street. And we are also very grateful to Virginia Street, who is Dr. Travell's daughter. So we've got some wonderful blog posts from Dr. Travell. And we'd also love to work with Dr. Carolyn McMakin, the last surviving spouse of Dr. David Simons. We'd like to provide some information from Dr. Simons on many of our platforms. And we also thank the surviving team members for Bonnie Pruden. So Bonnie Pruden has got some excellent myotherapy.org material, and I'd like to provide those resources to them as well. So you also, folks, you can go to the IMS website, and we would like you to utilize that as a resource. Let's see. There might be a way, if I may. Let's see what happens. I'm going to open my screen. So let's see if I can do a screen share. We're going to allow, it may not allow me. Select the window. Let's go for it here. So I do like to do this live during my programming. So I want to show you guys here, if I may, bear with me for a moment. There are lots of excellent resources. So Myopain.org, of course, is the Myopain home website. Let's see if it'll get us there. So there, we're going to be loading more resources here for which we're going to be articles, video done by Dr. Stecco. Down here under news, we've got all sorts of news things here. We're going to be hosting more research papers here, and we'll be putting more information, of course, under the education here, and information about our upcoming webinars. There are 2022 webinar schedule. And then under the other education tab, we've got some publications here, but we'll certainly be putting more. I've got plenty of publications, great publications by many of these folks. I'll be adding the PDFs of my publications there, but I will show you what is a great resource for all of you. Let's see, we can go to, so if you go to Chicago Trigger Point Seminars, there I've been getting some great help by Janet Travell's daughter, Janet Street. Here we have FAQs, which are free resources to all of you. And these are questions that are the #1 Google searched questions related to trigger point therapy. I had a wonderful working contract with Dr. Janet Travell Street in her promotional optimizing website group. So these are all available there for all of you to use. We've also got a glossary of terms here. So these are some frequently used terms for fascia. Fascia, I've got to add so much more, but we've got to add fascia manipulation. There is the David Lasondak book, a great supporter. We've also got information regarding Dr. Finley, Robert Schleip, whose name is incorrectly spelled here, so I will definitely fix that. And then we've also got a whole list of courses here. And I think that I told you that we've got a fantastic PAC webinar series given to us by Dr. Jim Frickton. These are all free. And Dr. Frickton is the past president of the IMS. And we're grateful to Dr. Frickton for all the information he's provided. And we've also got a program here by board member and past IMS president, Dr. Robert Gerwin. So there is a fantastic course here. It's $35, but I can tell you, if you become a member of the IMS, you will get a free link to be able to join this course for free. It is a phenomenal course by Dr. Bob Gerwin, of course, a legend in the field of myofascial pain research and study. So if you join the IMS today, everybody, we will be providing you a link for this excellent course by Dr. Gerwin for free. So we'd love you to join. Here's membership. This is where it says join the IMS. We need you. And I will be honest with you. Oh, well, you don't want to see my information. But this is where you would be joining. And we thank you, Peter. We thank many of the members of the NEMTPT who are already members of great organizations. But those of you that might be new, we really, really need you to join and donate. So one of the final things I'd like to say for today is I'd like to invite all of you to join our next month webinar. Here's our webinar series. We've got the wonderful coming for us on the fascial innervation and its component for myofascial pain. How phenomenal. We're looking forward to having that. So here is Katarina Fidesz. Wonderful. That's going to be July 7th. That's going to be 12 p.m. Eastern time. And you can just go right here where it says click here to register for the next webinar. We're so excited to join and look at some of the lineup of these phenomenal speakers. We've got Dr. Jim Fricton. We've got Dr. Bob Gerwin coming up. We've got Carmelo Pieri, who of course is a wonderful colleague of our current president, Dr. Antonio Stecco. We've got Dr. Renee Hartz, teaching about new findings in fibromyalgia. And then I know we had Dr. Mike Sorrell on the call with us today. Mike, we can't wait to learn about headache symptoms and headache syndromes and myofascial pain. So Dr. Stecco, if you'd like me to stop sharing or if you'd like me to go back to the primary screen, I guess I don't know how to do that. So there we go. So thank you, everyone. Thank you for being on the call. Peter, Pascal, Mary Jo, Volodis, Sue, Sean O'Shea. Thank you for joining us today, everyone. And let's really get you to join our group. Thank you, Lori. Thank you, Michelle. Thank you, Lorenis, Catherine. Thank you for all of you that have been on this call. We're so excited to have you. And I guess we're finished for today. Have a really great rest of your week. And please use these resources. They're free for you at the IMS website, at my website, and at the YouTube channel. And I look forward to seeing you maybe in one of my classes in the future. Thank you. Have a great day.